Hi, welcome to Dental Magic. Today we're going to show you what to do if you've got one tooth, two teeth, three teeth, or all your teeth missing. What your options are, what you can and can't do, and what's going to give you the best results. So, without much further ado, let's move on. A little bit about me. I've been a dentist for some 35 years. Been awarded for excellence in service by the Telstra Government Small Business Awards, and we're part of the fastest growing practice in the world 2013. So we must be doing something right with the way we look after people. So what are your options if you've got missing teeth? First of all, you can do nothing. You could have an acrylic part denture, a chrome part denture, or a bridge supported by natural teeth, or you could have an implant with crowns. Now we're going to go through each of these for you so you have a clear understanding of what your options are and what you can and can't do. First of all, the do nothing option. Well, it's not such a great look, is it? When for a relatively simple, easy sort of fix, you could get something into this space which will give you that smile back again. And that's what we're going to focus on today. So the acrylic denture is the first one. It's relatively quick and simple, can be made within days. It's quite thick in nature, as you can see here, so it's not as comfortable as you think it might be. It's something that you wouldn't rush in, and it's not a great denture and affects you eating, chewing, talking, and all those sort of things. If you're going to go for a part denture, you probably want to use this type of denture, which is what they call a chrome denture. Now you can see this one here is made out of metal, but it's all basically hidden as much as they possibly can, apart from the clasps. And because it's so thin, being metal, you can get the extra strength and you can get that comfort factor. Once again, it's held up there by little clips. You can take this in and out. Most people don't find wearing dentures all that comfortable, but look, for some, it's an option for them. To do the acrylic denture that we mentioned before, you're probably looking in the vicinity of around about $1,000. And with the chrome dentures, it could be $1,500, $1,600 depending on which dentist you went to. Option number 3, a bridge. In this case, you can see they've taken a shaving off the teeth either side there, and they're going to put a crown on this tooth, a crown on this tooth, and a crown in the middle, and they join them all together. This sort of option would be a good one if these teeth either side were heavily broken down or restored or stained or chipped or whatever, because you're really killing 2 or 3 birds with one stone. However, you are taking tooth enamel away and you're never going to grow any of that back again. So just be a little bit careful of that, but it does give a very nice result. Within 14 days, you'd have something which is up and going in your mouth. Cost-wise, it varies from practice to practice, but look, you're probably looking in the vicinity of around about $3,500. Using our payment plans, it could cost you as little as $15 a week, depending on which company you choose. We'll be discussing payment plans a little bit later, but you'll find that's quite an effective way of going about looking after things as well. So, what is an implant? It's made up of 3 components. The actual implant, which is placed into the bone, and the bone actually integrates or grows around it. You've got this part here called an abutment, which attaches onto the implant, and then a crown goes over the top of it. So a crown, it could be used to fill up multiple spaces, such as with a bridge, as we mentioned earlier on, and with dentures as well, which we'll also talk about. So what's the history of implants? Well, first of all, they developed some 30, 40 years ago now, and the success rate that this company developed the 4 key principles upon which modern implants are based on. They've been trying for centuries to do implants, but very unsuccessfully prior to this. Nowadays, depending if it's a top or bottom arch, overall you have a success rate of about 95%. If you're a smoker or on blood thinners or various medications, this type of thing would be something which would not be recommended for when you're doing implant work. With implants or any sort of surgery for that matter, we would always recommend that people get a second opinion prior to going ahead with anything. Now, as I mentioned before, you have the single implant. You could have 2 implants in with a bridge across. You could have something like this where they've got several implants and the denture will click onto that. Or you could have multiple implants fixing a bridge for a full mouth replacement. And this latter one is less common and the more expensive one that you often hear people talk about. Average cost for a single implant, you're looking in the vicinity of $3,500 to $6,000 and upwards, depending on what practice you go to. Utilising the payment plans with our particular company, you can be paying as little as $20 a week to get your implant done. Once again, depends on what company you choose. How does it work? The stages. Initial consultation. If you're not sure about things, come and see us. We would sometimes need to take some x-rays so we can assess how much bone you've got, where the sinuses are, where the nerves are inside the teeth. We then fix up anything that needs to be done in your mouth, such as fillings or extractions or cleans or root fillings, etc., etc. Now the implant surgery is then done. The implant's placed into the bone, and provided you've got enough bone, you don't need to have bone grafts or sinus lifts or anything like that. It can be done under a general anaesthetic or local anaesthetic. Local anaesthetic is by far the cheapest way, and quite frankly, we find most of our patients don't have any problem with everything being done under local anaesthetic. Sometimes a general anaesthetic might be better if you're doing multiple ones. We then let the implant integrate, or the bone grow around the implant, and after that's done, you can actually start to build up the crown or the denture attachments on top of it. We normally wait for 12 to 16 weeks for this to occur, and once that's started, within 2 to 3 weeks everything's finished. So it's a longer procedure than what we've been discussing with the other alternatives that you have, but it's a very good, long-lasting solution for you. This is what we call an OPG, an X-ray of someone's mouth. These are the sorts of things that we'd be looking for should you decide to go ahead with things. For instance, we ought to make sure you clear this big nerve here. The sinuses with some people come right down low here, and they have to lift the sinuses up and build up new bone before we can start things. In this case, we'd have enough room here to put an implant in and enough bone down here. These particular areas, you can see where the teeth have been taken out, and there's quite a large bony defect due to the tooth extraction that's occurred. These sort of situations we need to allow for healing time before we can actually build up with an implant into that area. This can be up to 3 months, if not longer. Once we've got the side healed, then we can put the implant in and start to build things up from there. So the implant, as we mentioned before, is made up of 3 components: the implant, the abutment, and the crown. There are various things which can add to the cost of doing an implant, as I mentioned before. One could be, if there's not much bone there, we've got to build up the bone in the area. It might need to have the sinus lifted up. If you're having general anaesthetic or local anaesthetic, these are all issues that can come into play and add on to the cost of things. Your dentist will discuss these with you prior to starting. Finally, when the crown is put on, it looks just like a normal tooth. You can't see into the metal part, which is all below the gum line, and you've got something you can treat just like a normal tooth. The chances of the implant failing are extremely low in the lower arches, often in the vicinity of 2% and 4% for the upper arch. Does it hurt? No. It's usually less traumatic than an extraction. We recommend people take the rest of the day off rather than going straight back to work. Can you wear the plate straight after? Look, try and keep it out as much as possible, but yes, you can. Can I chew on anything once it's completed? Yes, you just treat it like a completely normal tooth. Evidence so far indicates that they're very long lasting, so it's a great investment to improve your looks, your bite, your chewing, your talking, etc. What's the cost? Well, I mentioned the cost of those who went through. It varies from individual to individual, and as I mentioned before, there are things such as temporary crowns or temporary dentures or bone grafting, sinus lifting, or 3D imaging, which could add to the costs. Fees vary from dentist to dentist, but we're more than happy to sit down and talk to you and take you through everything. If you're in a health fund, the rebates will vary from fund to fund, so we can only give you the itemised code numbers, and it's up to you to check with your health fund. Basically, with an implant, $25 a week. Does that sound okay? I think that'll fit into the budget of most people. To find out about the different payment plans, go to dentalmagic.com.au. The ones which you pay interest in basically give you longer time frames to pay things off, and hence the lower weekly amounts. Also, if you want to find out 100 different ways to save on your dental bills, go to this other website. It's 100 ways to save on dental.com. It's got some really good cost saving strategies there as well for you. Okay, I hope you enjoy. Make sure you make your appointment soon. To do that, you can contact or email me on this number or this email. Look forward to seeing you soon. Regards, Dr. Jamie.